Okay, today, last day to sign up for health insurance through the Affordable Care Act. And we're already seeing the drastic impacts from Congress's failure to extend the ACA subsidies, a steep drop in enrollment. Federal data shows a difference of about 1.5 million Americans compared to last year as they confront significantly higher premiums. The change is causing people like this single mother with 3 kids to make tough choices.
I had heard a lot of people saying, oh, it's going to double or triple premiums. No, mine increased 7 times over. It's not just crushing my dream, it has crushed my daughter's dreams. It's crushing so many other families' dreams. Their small businesses are being squeezed by this. And I don't want other people to feel this pain that my family is carrying right now.
Joining me now, MS Now's Ariel Hickson and Audrey Morse-Gasteyer, the executive director of the Massachusetts Health Connector. That's the state's official ACA marketplace. Ariel, you spoke to that single mother in Georgia. What more did she tell you?
Well, Chris, she tells me that she is devastated by those high costs, and she's just one of millions of Americans across the country that are dealing with those skyrocketing premiums, which is causing so many people to just not have health care at all. And, you know, there are about 8 states across the country. You can see them right there. They're expecting to see those enrollment levels drop by more than a half. Teresa Acosta is from Georgia. I went to Georgia last week and spoke with her one-on-one. And she tells me that she has 3 kids, one with type 1 diabetes, another who was in college but actually had to take a break so that they could afford those mounting healthcare costs. Take a listen.
A little over a year ago, I had so much hope for my kids, and today it feels overwhelmingly crushing. I'm afraid for my youngest access to the medication that he needs to live. A type 1 diabetic can't live without insulin, and I'm afraid that if something happened to me that he would not be able to manage, you know, a system that doesn't value his life.
This is a real heartbreaking reality for so many Americans. Teresa also says she's very much concerned about the future for her children and concerned about their concept of the American dream. She expects to let her voice be heard during midterms this year.
So, Audrey, enrollment numbers obviously don't tell the whole story, as we just heard from that mom in Georgia. This has a ripple effect on family members. It has a ripple effect on local businesses. So as someone who runs the ACA marketplace in Massachusetts, are you hearing similar stories?
We're hearing exactly similar stories, and it is so concerning and alarming to hear Americans having to make choices like these. We are hearing from folks who simply cannot make the math work with these premium increases that they are seeing now. They are having to make trade-offs between rent, groceries, and their access to life-saving health care that's been a lifeline for them. So the stories are truly heartbreaking, and we're doing everything we can here in Massachusetts to support these folks. And Massachusetts, in many ways, is one of the best off states because of the leadership of our governor and other investments we've made. But yet we are still seeing increases in folks terminating their coverage and rolling the dice, hoping that they don't get sick this year.
Yeah, and I'm sure you're in touch with a lot of folks who are in your business in other states. Millions more people are expected to drop their health insurance because of these high prices. What effect will that have on our hospitals and on our healthcare systems in general?
This will affect individuals and their families, their healthcare, their financial security, but you're exactly right. It will ripple out through our entire healthcare system. When people make the decision to drop coverage because they simply can't afford it anymore, it's not as though they stop getting sick. It's not as though they stop getting injured or having accidents. These folks will still show up at our hospitals, at our community health centers, but they will show up sicker. And our entire system will bear an increased cost for the fact that we'll be needing to treat them in a sicker condition. We will all pay the price, and we will be a sicker and poorer country for it if this is not addressed by Congress.
As you well know, there's a bipartisan group of senators trying to work out a deal that they believe would revive the Obamacare subsidies. But if open enrollment ends today, is it too late to act? Can something still be done for folks?
Absolutely. So marketplaces all across the country have tools at the ready to implement help if it does come through by Congress. It will be a little bit more complicated now that we are into the plan year and after today for many states beyond the open enrollment deadline. However, states and the federal government have the option of opening open enrollment back up and communicating with people to let them know that help is here now. And that's exactly what we would do in Massachusetts. We would turn on a dime to get this help into the hands of the public that so needs it.
Ariel Hickson and Andre Morris Gasteyer, thank you both.